Hi, my name is Jennifer Weaver, and on behalf of Advancing Evidence-Based Practice, I'd like to welcome you to our October webinar on evidence-based probation. We'd like to thank John Riles for being here with us today, and we look forward to hearing from him. During the webinar, if you need technical assistance, you can send me a question via the question box, and I'll respond to your concern. If you have questions about the presentation, type those in as well, and we will address those at the appropriate time. Our presenter, John Riles, is the Evaluation and Treatment Supervisor for the Jefferson Parish Department of Juvenile Services. Across his 18-year career in juvenile justice, Dr. Riles' diverse experience includes direct therapeutic services, program implementation, accreditation, policy analysis and development, and strategic planning. He is involved in almost every aspect of the local collaborative, the Children and Youth Planning Board, and Juvenile Justice Reform Initiatives through the John D. and Catherine T. MacArthur and the Annie E. Casey Foundations. In 2002, he was reappointed by Louisiana Governor Bobby Jindal to a second term on the Juvenile Justice Advisory Board, where he chairs the Grant Review Committee. He is a 21-year retired Senior Chief Petty Officer Hospital Corpsman of the U.S. Navy Reserve Component. We will now turn the time over to John. And John, thanks again for being here with us today.
You're welcome, Jen. Thank you very much, and good morning, everyone. It's really great to be here and have an opportunity to talk to you a little bit about the things that we've done in Jefferson Parish. We've made some substantial improvements in our evidence-based practices, and so it's really nice to be able to talk to you a little bit about that. So as you can see from the screen, we're going to talk a little bit about evidence-based practices and how we implemented those in our probation department. And so we'll get on with the presentation. So we start off with the whole idea of what an evidence-based practice is. And what I'm showing here is a federal workgroup standards of what evidence-based practices are. And if you look through that, you can see that, a lot of times we throw around the terms evidence-based practices, and I think that term is a bit overused in that we really don't have a definitive idea of what that is. So if you look at it, the strictest criteria for what an evidence-based practice is right here. And if you can see, the experimental design randomized controlled trial, you need one of those. You need to have at least a 1-year post-intervention sustained effect. You need at least one independent replication with a randomized control trial. The randomized control trials have to be methodologically sound and also no known health compromising effects. But there are other standards that people use, but this is the strictest definition. So then what I'd like to look at a little bit is some of the impact of how we've increased evidence-based practices in Jefferson Parish. So what I'm showing here in 2008, you can see the graph, we had 35% of our youth referred for services received evidence-based practices. Also in 2008, we were undergoing a reform effort with the MacArthur Models for Change initiative. And in that initiative, one of the targeted areas of improvement were evidence-based practices. From that point on, we began a process of identifying evidence-based practices and trying to implement them as much as possible. And if you look at some of the results there in 2010, 11, and 12, we had increased our evidence-based practice utilization to 95, 99%. Now that's wonderful, but you may be asking yourself, what kind of outcomes did we have as a result of that? Or what was the impact of that? And so the next few slides, I'd like to show you some of the data that we've been collecting over these years. And although there's not a causative effect, there is evidence there that what we've been doing to help these kids not engage in the juvenile justice system has worked. So the first slide of data that I'm showing here, if you look at the red box, you'll see in 2010 from our probation caseload, we decreased from a high of 1,711 in 2004 to 839 in 2012. And those numbers have increased even lower in 2013. That's our projection anyway. And before we go on, I'd like to note something. In 2005, as many of you know, 2005, Louisiana suffered Hurricane Katrina, and a large number of the population left during 2005 and started trickling back in 2006. By 2007, most of the population was already returned to Jefferson Parish. And as you can see from this chart, there's an increase in the probation caseload, because the kids are coming back. Once we started implementing the evidence-based practices and a number of other reforms, we started to see a decrease in the number of kids on probation. Also, looking at our detention center admissions, we showed a 43% decrease from 2004. And as it's indicated on the slide, in 2008, we also began the Juvenile Detentions Alternatives Initiative with the Casey Foundation. And with that initiative, we started to work with some evidence-based practices, screening and assessment practices that we'll talk a little bit about later. And you can see the reductions in our detention center, and there's all kinds of results that have happened as a result of us decreasing these numbers. And then lastly, if you look at this data, you'll see a 36% decrease in juvenile arrests from 2005 to 2012. And we're very excited about these numbers because when we think about the end result of what we're trying to accomplish, that result is that we're trying to improve the lives of children and youth in our parish, and you can see that we're making some impact with that. So let's talk a little bit about some of the things that we did in terms of treatment before we implemented evidence-based practices. The idea of treatment as usual, that we really didn't have much of a plan. Some of those challenges were organizational challenges in that we wanted to make sure that the programs were accountable for outcomes. We'll talk a little bit more about that, but holding them accountable for outcomes as opposed to simply just providing a number of services was something that was new to us. Also, the resistance to change. We had some folks, not only providers but stakeholders, that just wanted to provide the same services as they did before without any kind of change at all, and that was difficult for them. And then there were some personal biases where stakeholders and people in the community, providers, believed that certain things were true when the research didn't bear it out, or there wasn't enough evidence to support that it was effective. So departing from the personal biases, particularly with those people who tend to be influential in decision making, was a difficult challenge for us. Also, we had some challenges regarding our programming. One thing that we assume is that just because someone has a high degree of qualifications, that means that they're going to have a high quality of their product or their service that they provide. And that wasn't necessarily the case. Because someone has every letter of the alphabet behind their name doesn't mean that they're qualified to provide a particular service, and that was a challenge for us. Also, maintaining fidelity to the model with which they were using. That was a difficult thing because there was no way to check that to determine whether or not they were going to continue to use these, to implement the models in the manner in which they were designed. And also sustainability, because as many of you know, one of the difficult things is that when funding becomes short, the treatment social programmings are usually the ones that are first to be cut. One of the things that we did in order to secure buy-ins for evidence-based practices is that we have the development of Children and Youth Planning Board, which is a group of juvenile justice and child welfare stakeholders from across the community that work with children and youth. And among this collaborative, we wanted to make sure that we had enough buy-in for implementing evidence-based practices. And so we wanted to agree on a common philosophy. We had folks there from law enforcement, from prosecutors, public defenders, all at the table. And when trying to explain to them evidence-based practice, oftentimes we would get the feedback that maybe we weren't giving them enough consequences. And so when we started to explain what evidence-based practices are, we could transcend some of those philosophical differences between the different groups. And the way that we did that is that we wanted to emphasize cost and benefits, and effectiveness, and then research results, so that we could hit on the major philosophical points that each person on that board was adhering to. we agreed that there were certain outcomes that we wanted from the children and youth. While there were some people who believed that our juvenile justice system was set up to cure the child of every ailment that existed, a better argument for us was to identify outcomes for these kids and families that were specific to their criminogenic need. That is, to those needs that have been associated with delinquency and violence. And when we could agree upon those outcomes, it made it a lot easier for us to target the kinds of services that we wanted to implement in terms of an evidence-based practice. Also, what we wanted to impress upon our stakeholders is that because a program is politically popular does not mean it's effective. And that's something that is a bit difficult because there's a lot of buy-in to some of these programs, and when you look at the research, it's shown not to be effective at all. And then we embarked on a method of training and education that allowed us to explain to stakeholders what evidence-based practices are, what are the outcomes that we wanted to achieve, and what were the baselines. And all of this required additional effort in data collection and training. We had a workshop, a 2-day workshop, and so that was some things that helped out our stakeholders. I'm trying to get this thing to change here. Okay, there we go. Apologize for that. Another way we wanted to secure buy-in for the evidence-based practice is that we wanted to move away from the notion that folks knew that their services worked because they'd been using it for a long time. And I'll give you a story about that. We had one provider that we told him that we were trying to implement evidence-based practices. And this provider told me that he knows that his services work because he had been providing services to 10,000 families for 20 years. And when I asked him how he knew they were effective, he would say that he knew they were effective because when he saw the families and the children in the mall, they would say that they were doing fine. And I'd like to repeat that story because it's just one of those kinds of things that just highlight where we are or where we were in providing services to our kids. The other point that I like to impress upon our stakeholders is that if you don't know what kind of outcomes your programs are giving you, then you may be doing more harm than good, which is a scary concept for people who are really invested in the idea of bringing youth from a point where they are involved in juvenile justice to a point where they are no longer likely to engage in the juvenile justice system. So it's important to know the outcomes of the programs that you're having. And another thing, you know, there are very tough financial times now. And one of the things that was very impressive for the people who were interested in spending money or saving money was that we really didn't know whether or not the services we had were giving us a positive impact. If you don't know that you have a positive impact out of your programs, then you really don't know that the services that you're providing or the money you're spending is being spent effectively. There are some things that I think were very influential in our decision making, and that is cost-benefit analyses from the Washington State Institute of Public Policy. And I included the website on there. There is a great deal of information and publications that you can use, and we'll look at some of that in the next slide about how they go about identifying what programs are effective and the cost effectiveness of it. And I'm going to share that with you now. So here's the first slide. Well, it's the only one, and I think it's very important to look at. If you look at the bottom, you can see adapted from Barney Barnowski and Steve Ose from the Washington State Institute of Public Policy. But if you look in the left-hand column, you'll see functional family therapy, multisystemic therapy, restorative justice, nurse-family partnership, and then scared straight. The next column, you'll see an effect size, which is basically an understanding, a cumulative impact of the program on reducing kids' involvement or participants' involvement with juvenile justice. And you can see the negative percent there is a reduction The number in parentheses is the number of studies, and you can look down at the type of impact over the number of studies, the average number of impact that the evidence-based practices have on kids in getting engaged in the system. And one interesting thing I like to point out, well, there's a couple in that column, the nurse-family partnership for mothers had a 56.2% reduction in involvement in the juvenile justice system or the delinquency system with one study. That is amazing. If you drop down to the box below that, you can see that the Scared Straight program increased. Over 10 programs increased kids' involvement in the juvenile justice system. So it makes me scratch my head a bit, quite a bit, and talk a little bit about our current TV program, Beyond Scared Straight. So that just makes me wonder a little. If you look at the marginal costs, you can see functional family therapy, MST, pretty expensive. Restorative justice, relatively low. Nurse-family partnership is, you know, relatively expensive. And Scared Straight is cheap. And so you can understand how it's politically popular that you have Scared Straight programs, but they're really not effective. Then if we look at benefits to the community, the last column in the right, we'll see the impact of that investment, that $2,325 for FFT. You can see the impact of that in benefits on the community. And so you can see that FFT benefits the community $31,000. And if you look at Scared Straight, $14,667 cost to the community. I think that is an important slide to show to stakeholders so that they can understand how using the right programs can have an impact on the bottom line. So let's talk a little bit about why we would want to use an evidence-based practice. And we want to use evidence-based practices, and you can see my little clip art there, kids fighting and drugs and, you know, someone who's obviously very angry. We want to use evidence-based practices because they have been validated through research to change very specific behaviors. And so there's a research basis for it. We know that it can make an impact on the target behaviors that are within your jurisdiction. Also, they're based on sound scientific principles that show that, you know, if you use this particular approach in this method with this manualized approach with this particular youth, then you can have the kind of impact that the research is showing. If you're not using evidence-based practices, you can't be sure of that. And also, evidence-based practices will target diverse needs across diverse groups. Oftentimes, for many of these evidence-based practices, they have been validated and researched with diverse populations. For example, certain minority groups and certain gender groups in certain settings. So, you know, that's some of the reasons. And some other reasons why you'd want to choose evidence-based practices. There are some generic evidence-based practices and there's some name brand evidence-based practices. And I think oftentimes folks have an idea that evidence-based practices are going to be expensive. As you could see in the slide, the previous slide with the costs, they're not always that expensive to implement, particularly with restorative justice and cognitive behavioral therapy. These are relatively inexpensive. Motivational interviewing, restorative justice, those are the kinds of things that are relatively generic. And then you have the name brand evidence-based practices such as multi-systemic therapy, functional family therapy, moral recognition therapy. ART is aggression replacement training, and then active parenting for teens. There's triple positive parenting program out there as well. Some of the targets that we wanted to identify in our work with Jefferson Parish were family functioning, which our evidence-based practices are the ones that are shown on this slide, multi-systemic therapy, functional family therapy. EBFT is the Boys Town in-home family services model. We call it ecological-based family therapy, and nurse-family partnership and active parenting. Aggression and violence were things that we have in our juvenile justice system that we want to address, and that's aggression replacement training and moral recognition therapy. And then grief and trauma. As you know, there's been a big link of trauma-informed care and crossover youth, dually involved youth who have experienced abuse and neglect in their childhoods, early childhoods, and their matriculation into the juvenile justice system. Well, we can see that we have programs there that impact those youth to decrease their impulsivity and their poor decision making. So when you're choosing an evidence-based practice, there are some things that would be helpful for you to choose them. One of the things we want to do is to commit to evidence-based practices. We don't want to commit to programs that have questionable outcomes or that we really don't know what they're doing. An evidence-based practice has been proven to work, as I've said before. And the ineffective programs, if they're questionable or if you don't know the outcomes, you're really not going to get the bang for your buck that you're thinking you are. Also, you want to implement the evidence-based practices with fidelity to the model, and there's got to be a mechanism that you implement that's going to allow you to do that, and we'll talk a little bit about that in a while. We want the fidelity to be there so that when we see the outcome really is the outcome that is given by that particular program. And when we have discussions about whether or not the program works, we can say that the program works because of the outcomes that we've collected. And those outcomes are a result of the model that we're using. We also want to report successes as often as possible because there are people out in the community or in your stakeholder group that are not as accepting of evidence-based practices or just rehabilitation efforts in general as others. So when you report your successes, it allows your stakeholders to see, and the people who are holding on to the money, it allows them to see that there is a light at the end of the tunnel, that you can fulfill the promises that you made by implementing evidence-based practices. If you're not collecting the outcomes, you're not reporting your successes, your evidence-based practices, in my opinion, are going to be short-lived because the people who are making the decisions about whether or not to spend money on your practices, they probably won't continue the funding. And again, getting back to outcomes, you want to track those outcomes. And you want to track those outcomes wherever possible using valid and reliable screening and assessment instruments. Because we want to assess needs using these valid and reliable assessment instruments, we want to track and measure changes over time with screening and assessment. So that if you implement an evidence-based practice on a youth, you can look at a before test and an after test and determine whether or not there was some movement. Now, it would be difficult to pin that specifically on the evidence-based practice because in probation there's a lot of other things going on. It's not a sterile environment. But it is good to be able to track that movement so you can see if the programming as a whole has an impact on the behaviors. And also, we want to avoid implementing evidence-based practices because you want one. I think that oftentimes people hear the term evidence-based practice and they say, we've got to get an evidence-based practice, but they really haven't gone through the homework of identifying what outcomes they want to implement or to target, and because of that, they don't know what kind of EBP to implement. And then when the evidence-based practice has been implemented, they struggle with trying to show the stakeholders that that evidence-based practice really made a difference. So avoid implementing evidence-based practice because you can get one or because you want one. There has to be an identified need there. We'll talk a little bit about performance-based contracting and how we go about contracting for these services. For juvenile services, Jefferson Parish, the key mechanism that allowed us to expand our evidence-based practices was our professional services contract. While we had other providers out in the community who were implementing these practices, it was difficult for us to put those in place without having a contractual obligation from the provider. And so some of the things that we set out to do was based upon these ideas that we didn't want to buy more light bulb. And that goes to my earlier comment about not buying more services, but buying more outcomes. We had services that we had very large capacity for putting youth in treatment, and we could refer kids over and over again for multiple rounds of therapy, and that we didn't know if that was effective or not. We wanted to instead change our performance-based contracts to focus rather on how many services you can provide for us in terms of capacity. We wanted to focus on what kind of outcomes you can get for us. So we wanted to make sure that the providers knew that we were no longer trying to figure out how many kids can you take. It's important that you have capacity, but it's even more important that at the end of the day, when you're finished your 16, 20 sessions or however long the evidence-based practice model calls for, that at the end of those sessions, you have demonstrated, or the youth has demonstrated, a specific change in the target behavior they were referred for. That was a new mindset for us, because up until that point, we did not have that mindset. We just wanted to refer them to services, and if the kid changed, great. If the kid didn't change, oh, sorry, kid didn't work out. We got to move on, try something else. And so the notion of buying more light was very helpful for us. With these contracts, we also wanted to look at the fact that sometimes money gets tight, and that is a common factor across many jurisdictions. And when money is tight, social services are the first to be cut. Some of the reasons that we can keep those services around is by justifying the outcomes or providing outcomes to the people who are cutting them. So in effect, we are providing the stakeholders and the people who are making the decisions to keep them with the funding, we're providing them with an opportunity to see that there are some tangible results from that. And so when you focus the money on outcomes and not outputs, it makes that argument much more easy to make. And I think the people who are making the decision to transfer that money or give that money for the evidence-based practices, when they can see the results and reductions such as the slides that I showed you initially in the presentation, when they can see that, it makes a big difference in their ability to say, well, we could build this bridge, or we could put these services in protecting the community. And then in our performance-based contracts, we wanted to make sure that contractors have clear goals for performance in terms of outcomes, not in terms of how many kids they could address. That was very important. And our treatment providers did a very good job in maintaining those performance standards. There were some, though, including the fellow that I mentioned that talked to somebody in the mall to determine how effective his services were. Not surprisingly, after the second round of performance-based contracting, the solicitation, he didn't submit. And we were glad for that, because he probably wouldn't have gotten picked up for a contract anyway. I hope the clip art adds a little bit to the conversation. I know sometimes it's a little difficult to look at the screen over and over without any pictures. So on these slides I had some. Unfortunately on this one I do not. So I apologize for that. It's kind of hard to find clip art for a slide like that anyway. So let's look at some traits of effective programming, and these are the kinds of things that are going to shape your performance-based contracting if you're going to lean that route. Your providers need to know what the research says about implementing evidence-based practices properly to get the biggest effect for the money that's being spent. So the first thing that we talk about is intensity. So the intensity and the frequency of sessions, for example, aggression replacement training will meet 3 times a week. So it has to have the right frequency of sessions. Also, you have the duration. So functional family therapy will last 6 to 12 months. And in that, we know that we are monitoring those cases and making sure that they are targeting the outcomes that we've been referred to. And then the last thing is that we want to have implementation quality. I think that oftentimes there's a regression toward doing business as usual, but what we want providers to do is to make sure that they are meeting with their supervisors every week to be supervised and adhere to a specific model. So in our performance-based contracting, we have training funds built into the contract, training that I approve. And when that training is, they can go anywhere and receive training on a specific evidence-based practice, and we will fund that. And then that person who was trained goes back to their agency and provides clinical supervision for people who are actually working with our clients. And that supervision takes place weekly, and it seems to have worked out pretty good so far. One of the other things that I'd like to note in this, when we're looking at these traits of effective programming in terms of intensity and duration, if we were to do let's say a 12-year-old kid, and we were to look at the kid's involvement with their family, and if you look at a 12-year-old kid and they spend 365 days a year with their family, and then you multiply how many hours that is times 24. Let's see, we got about 105,000 hours with this family. And if you think about the context of that, how many hours of therapy does it take for us to undo one behavior? And that behavior is going through 105,000 hours. So if you look at that, it just makes sense that we have to have the right intensity, the right duration, and the quality has to be there in order to target that specific behavior. So when we're looking at enhancing the mission objectives for particular agencies, we want to look at what your agency's mission is. Oftentimes we're pulling evidence-based practices from whoever comes to us with a nice proposal, and yeah, we have an evidence-based practice now. But we want to look from an agency perspective at what is the mission of that agency, because that's going to help you determine what your evidence-based practices are going to be. It's not the other way around. It's not, oh yeah, there's a whole spirit of the system to move toward evidence-based practices, and Joe Blow on the corner has an evidence-based practice, let's use that one. We want to be very specific about how we and what evidence-based practices we implement. And so, for example, juvenile justice. Our mission is to habilitate youth and then prevent recidivism, because that's our job. That's what we get funded from the community for, and that's what we're responsible for achieving. And when we do that, we want to look at targets that are known to be associated with youth who are in the juvenile justice system. And again, we call that criminogenic need. So not only do we have to have a method to identify criminogenic need, but we also have to have services that target specific criminogenic needs and other needs that come up as we implement them. And I'll give you some examples. We know that there are some youth that have very impulsive decisions. They have substance abuse issues. They have family problems. We have evidence-based practices that can address those. But there are some specialized areas that are very difficult to achieve services for, and that's things like sexual perpetrator therapy. So in that area, we specifically solicited for sexual perpetrator therapy that is evidence-based. So we were able to find a program for cognitive behavioral therapy based sexual perpetrator therapy and a model from an expert in the field. And so we had the target from our agency mission to target these behaviors that don't have services in the community, and we were able to put a practice in place that enables that need to be met. And in looking at your programs, your programmatic outcomes, it's important that you look at that early, and those outcomes are going to flow from your agency mission. So the question is, how do we expand evidence-based practices? And some of the ways that we expand the evidence-based practices is that we want to put our money where our priorities are. Do you want more services or do you want better outcomes? I think that that's a question that many people ask, and they strive to have more services because they believe that that's going to make a bigger impact. But you can send kids to treatment for years and they won't make any impact to some treatment as usual approach, versus sending them to a specific evidence-based practice that targets a very specific behavior, and they could change that in a relatively short period of time. So do you want more services or do you want better outcomes? If you want better outcomes, there are services for that. When you have a good portfolio of evidence-based practices, you also have fewer youth in the system, and that saves money, and that money can be reinvested into additional programs. And when we're talking about money, just kind of on an aside, in Jefferson Parish we are funded by a local millage on property tax, and that money comes from our parish, which in other states or counties, and we fund it from property taxes. So we're not dependent upon any other source of funding. We don't do Medicaid funding. We're strictly funded by the taxpayers of Jefferson Parish. And so back to the funding issues, when we save money, we can put that money into additional programs. And if you recall that slide where we have fewer youth on probation, I'll tell you a little bit about what we were able to do with that. Since we have fewer youth on probation, we were able to get fewer youth treatment from probation. We didn't need as many treatment services. So rather than letting the well-trained treatment providers in the community dry up, we were able to extend some of these treatment services, the high-end programs like functional family therapy. We were able to extend that to our informal status offender program. Here in Louisiana we call those FINS, Families in Need of Services. So they're pre-trial, pre-petition. We were able to leverage that money and those services to provide money on the front end for kids that were at high risk of coming into juvenile services. So we're very excited about being able to work with our status offender programs and in some hopes of developing the beginnings of a status offense model that will allow us to keep those kids out of the court system. So that I think was some things that we were able to do. Now, I kind of ran through this, I think, a little bit fast. I'm kind of on the end, so I think we may now have some time for questions, I believe.
We don't have any questions quite yet, John. But I can launch a poll. Okay. I can launch a poll, or I'm not sure if Peter had anything to add.
Can you hear me now?
Yes.
Yes.
So I was going to just jump in here for those of folks who are listening to this. As you know, Advancing EBP has picked Louisiana as our kind of poster state in terms of what they've been able to do with evidence-based practice. And we've worked with them to come up with this idea of an evidence-based practice academy, and that was funded by the MacArthur Foundation. So that'll be taking place in 2014 sometime. We're already talking about it. I think according to Deb, probably it's going to be in Lafayette. I think she's got good connections with the university there. And the idea is to bring in other states. So John Riles will have many peers to talk to from other states, and these are hopefully people who are interested in expanding EBP in their state. And John certainly played, you can hear from the way he talks, he's been educating those stakeholders and bringing them up. And when you go to Louisiana and you see the enthusiasm of those judges and those prosecutors who can repeat a lot of those lines on John's slide about why you'd want to be using evidence-based practice, you see how they built up the local support for this kind of an approach. That's mainly what I want to add.
Thank you, John, so much for being here with us today. We're going to launch a quick poll, so if I could have everyone's attention, look at your screen, and you'll see that pop up in just a second here. And here's another poll. And just two more. And this is our last question for you to answer. Lots of positive feedback, John. Thank you so much. I can tell that the attendees thoroughly enjoyed and learned a lot from your presentation today.
You're very welcome, and thank you for the invitation. And I invite, with this last slide that I had up, I invite anybody to contact me. I'd be happy to help out and talk a little bit more about some details of the things that we've been able to achieve here in Jefferson Parish and across Louisiana as well.
Perfect. Thank you again, everyone, for joining us today. If you liked what you heard today and you'd like to share this information with your colleagues, you can visit our website in the next few weeks, and you will find a recorded version of today's webinar. That's at www.advancingEBP.org. And make sure you join us next month for our November 15th webinar on the fiscal side of EBP costs and reimbursement rate by Beth Rossica. Have a great day. Thanks.